Hi, my name is Dr. Mark Lucky, and this is Dakara, my medical assistant here at West Ashley Wellness and Rehabilitation. We're so happy that you're here with us today. We're going to be discussing why DNA testing, and then once you understand why DNA testing is so important, how to properly perform a DNA test and then get it over to MTL, which is Molecular Testing Laboratories. So the purpose of a DNA test is to find out if our patients are actually absorbing or metabolizing medications correctly. If they're not metabolizing medications correctly, it can certainly cause them a lot of different symptoms and health issues. So as physical medicine offices, it's really important to know that our patients are utilizing any medication that they're on to the best of their ability. Test for about 9 different pathways, so I know it fits in with our model well. So today, the purpose of the video is to go over how to fill the paperwork out properly, how to do the buccal swab properly. We're gonna have Dakara that's gonna perform that on me, and then how to actually get it sent to, again, MTL or Molecular Testing Laboratories. Just on a side note, we use Molecular Testing Laboratories because they do more DNA testing than any other lab in the country, and they're the gold standard. They're highly compliant, and they get most of their DNA tests adjudicated and paid for through the lab. So really excited about using them, and they've been wonderful to work with. So the very first thing I want you to know is the requisition form, how to fill that out. This actually comes in your dry kit swab. So when you pull this information out, you're gonna first notice that the sheet is standard 8.5 by 11, and there's gonna be some yellow here. The yellow needs to be all filled out. So on the left side, you'll see the sample collection date. You're gonna put the date that you collect the sample. You're always gonna hit the comprehensive genetic testing panel, and we wanna get a list of the medications that the patients are on. And hopefully you're getting that list when you do the case management from the beginning of a patient coming into the practice. That's not in yellow, but it's very vital that we have that information. And then you're gonna see patient demographics, the last name, the first name, the street address, the city, state, zip code, and of course, date of birth. We need to know if they're male or female as well. And then you're gonna put down some information about your practice. The physician's office phone number, office contact, the NPI number for the physician ordering it, and then physician authorizing name. That could be your medical doctor, your physician's assistant, or your nurse practitioner, and then their signature as well. What we do in our practice is we go ahead and we attach the insurance information as well as the patient's ID. So we hit bill insurance or check off bill insurance and then put C attached. And then very vital and very important to have the patient print their name, and actually the MA can print the patient's name and have them sign it there, and then click this or check off this buccal swab. And then on the back you're going to see there is the different diagnostic codes for your medical providers to check this off. In our offices, because we are physical medicine offices, most of our patients come in because they have pain. But you can see here there's an array of diagnosis codes that you can choose from. Anything that you want to add here, additional ICD-9 codes can also be added. And then have the medical professionals check off anything that's necessary on this form here. For instance, for me, patient medical necessity, patient has a history of medication failures. And then please check all apply here. As a component of my medical decision making as to which medications to avoid this patient. So as you see this and as your medical providers see this, they'll check off the appropriate box as well. So that takes care of the requisition form. The challenge is this: if the requisition form is actually not filled out properly, then the lab cannot get you the results for that patient. So it's really important that this is filled out properly. So what I'm going to do now is I'm going to turn it over to Dakara and let Dakara go over the buccal swab itself. Dakara?
Well, thank you. The first thing you need to make sure you have all your materials, which should be included inside of that large packet. And the only thing that's not included are some gloves for your medical assistant and a cup of water for the patient to rinse their mouth out. So the first thing I'm going to do is ask you to please rinse your mouth for me for about 20 to 30 seconds, and then you're just going to spit that out. Make sure they get both sides of their cheeks. Right. So included in that package should be 2 of these, which are your cotton swabs. So you're going to open one at a time, and when you open this, the stick should be pointing upward. And When you pull them out, just make sure you don't touch the cotton swab tip. So the first thing you're gonna do is grab that small sample envelope, fold it in half long ways, and just sit it on the table. That's gonna be for your cotton swab to dry on. So you're gonna swab the first side of the cheek for 20 to 30 seconds. And then just sit it right there and let it dry. And do the same with that second cotton swab in the same package. And then you're going to pick up the second package and you're going to do the same thing with the other side of the cheek. And be sure not to touch the cotton tip. And that's all to do on the cotton swab. Just make sure you allow those to dry for about 3 to 5 minutes because you don't want to put it in the envelope while they're still wet.
Thank you, Takara. So let me ask you this. Once you actually perform the buccal swab and you let them dry for, as you said, 3 to 5 minutes, what package or what envelope does the cotton swabs go into?
Those cotton swabs are going to go inside of the same small envelope that you folded in half. When you go to pick them up, just make sure you grab them by the end of the tip, not the cotton tip, and just tuck them inside with the cotton down first.
Fantastic. So on this small form, and I won't pick it up now because the cotton swabs are, of course, drying, you're going to see some information. It says small sample envelope for test. You're going to actually write in there DNA sample. It's going to have an opportunity for you to put the patient's name, the patient's date of birth, the date of collection, who collected it, and the phone number. It's also going to ask for the physician name or the nurse practitioner or PA's name, and any notes that you want to put on there as well. So let's just say that we've had this for 3 to 5 minutes. So go ahead and pick those up, Takara, and let's stick those in the envelope.
Cotton swab downward.
Fantastic. And then we're going to peel this off, correct?
Yes.
And then fold it up. The next thing you're going to do is you're going to actually take some information and put it in this larger envelope. There's 4 things that are crucial to be in this larger envelope in order to get the DNA test to MTL, Molecular Testing Laboratory, properly. One is, of course, the buccal swab. The other thing is the DNA test that must go as well, the requisition form filled out properly. And we just slide that right down there. Well, the third thing is going to be the medication list. And the medication list, of course, you should have that from the case manager, and also the insurance information. And the insurance information will be the patient's driver's license or ID card and their insurance card, front and back copy. And then the very last thing that you're going to put in there is you're going to put a note from your medical provider, your medical doctor, your nurse practitioner, or your PA. And the note simply says, this patient was ordered a DNA testing kit for the purpose of seeing if their body metabolizes medications correctly or not. And my nurse practitioner told me today that she'll actually add any other information on that sheet as well. We want it dated, and it's really easy if you have electronic medical records to add that macro in there. So you can just put the patient's name, print it out for the day that you actually did the sample. So in other words, if a patient had come in with some knee problems, they were on some pain medication, history of pain medication, she would write that in that note as well. So once we have all those things, including that note, remember we've got the note that I just spoke about, we've got the DNA, the buccal swab itself, we've got the insurance information, and we've got the requisition form. Once that goes in, then you wet the envelope and close it up. And from there, it's going to go out to FedEx. And I'm going to have Takara talk about that.
Okay, so what you need is any size of a FedEx envelope or a box. This particular size we use here in our office. And then your stamp that'll go on front of the envelope to let you know where this is actually being sent and where it's coming from. So molecular testing labs, they don't want any more than 8 of these in one packaging envelope. And this one right here, we do no more than 4 because of the size, but depending on the size, you can put up to 8 in there. So what you're gonna do is just stick this inside of that FedEx envelope, and then make sure you stick your packaging slip on the front. Just like that. And this should be sent in 2 to 3 days, no more than 3 days after the swab has been done. So right now, since we just have one, I'm gonna hold on to this envelope and not seal it just yet because we may have more. But no more than 4 in this size right here, but no more than 8 for molecular lab testing.
So molecular testing laboratory will actually send out the FedEx boxes for you, along with the dry kits, which are free to the offices, as well as the shipping labels. So what we're gonna establish, guys and ladies out there, is we're gonna establish meaningful use with these dry kits. In other words, we wanna show the insurance companies before we start running the wet kits. The difference between a dry kit and a wet kit is simply lidocaine in the kit, and the wet kits do cost the offices money, but we're gonna establish meaningful use by using these free dry kits. What I want you to do, ladies and gentlemen, is use those dry kits on every patient that comes into the office. Swab everybody, doesn't matter what their insurance is. Once we get your Vantage number